How do targeted therapy drugs overcome resistance in lung cancer? Imagine fighting lung cancer with precision tools designed to attack specific parts of cancer cells. Targeted therapy drugs have transformed treatment by focusing on molecular changes in tumors. But cancer is clever and can develop ways to dodge these drugs over time. Understanding how they overcome resistance helps us see the ongoing battle between medical science and cancer. In lung cancer, especially non-small cell lung cancer, resistance happens mainly because cancer cells adapt. One way is through on-target resistance. This means the cancer develops new mutations in the very molecules the drugs target, like the epidermal growth factor receptor or the anaplastic lymphoma kinase. These mutations change the shape of the target, so the drug can no longer bind effectively, making the treatment less effective. Another way resistance occurs is off-target resistance. Here, cancer cells activate other signaling pathways that bypass the blocked target. For example, if the primary pathway is shut down, the tumor might amplify the MET gene or mutate CRAS, which can reactivate cell growth signals despite the therapy. This allows the cancer to survive and continue growing even in the presence of targeted drugs. Cancer cells can also upregulate other receptor proteins like insulin-like growth factor 1 receptor or AXL. These molecules maintain survival signals, helping the tumor escape the effects of the therapy. Sometimes, the cancer even changes its cell type, a process called histological transformation, shifting from one kind of lung cell to another, which can make targeted treatments ineffective. To tackle these challenges, scientists have developed next-generation inhibitors. These drugs are designed to bind to mutated forms of the target proteins, overcoming on-target resistance. Combining different drugs is another key strategy. For instance, using an epidermal growth factor receptor inhibitor along with a MET or AXL inhibitor can block multiple escape routes at once, delaying resistance. Targeting downstream pathways is also effective. If resistance arises because of activation of pathways like RAF-MEK-HERK or pi 3 degrees Kelvin AKT, drugs that inhibit these signals can be added to the treatment plan. Personalized medicine plays a vital role too. By analyzing the genetic makeup of a patient's tumor, doctors can identify specific resistance mechanisms and tailor therapies to address those unique changes. Researchers are exploring innovative delivery systems, such as carriers that co-deliver oxygen and drugs, to overcome microenvironmental factors like hypoxia that contribute to resistance. Monitoring tumor genetics regularly during treatment helps detect resistance early, allowing adjustments before the cancer progresses further. Understanding and overcoming resistance is essential for improving lung cancer outcomes. While targeted therapies have opened new doors, resistance remains a challenge. Ongoing research and personalized approaches are key to staying ahead in this fight. Always remember, patients should work closely with healthcare professionals to determine the best treatment options for their individual situation, as resistance mechanisms can vary widely. The goal is to keep advancing treatments so that more patients can benefit from the promise of targeted therapy.